Hello, I'm Dr. Renee Murray Bachman. I am the Certified Diabetes Care and Education Specialist at Lenox Hill Hospital, where I am also a nurse educator. And with me, I have
Deanna Huxell-Gaffney, registered nurse and diabetes champion. I'm 4 years.
and she's an amazing one at that. I know that all of you at home have learned how to use insulin pen before you before you were discharged from the hospital, but we just thought we'd put together a little video to remind you. Sometime when you get home, you forget things. That's perfectly human and normal. So here we go. This is going to be to remind you of how to use your insulin pen. Alrighty, so what am I going to do first, Deanna?
We're going to make sure that we have all of our supplies.
Absolutely.
And you're going to first use Purell or any kind of soap.
So we want to make sure our hands are clean. You've noticed in the hospital when the nurses come into the room to do a procedure or just to walk in to talk to you, they clean their hands. Well, you are going to be our nurse at home and you're going to clean your hands before you give yourself an injection. Now, what's that in your hand, Deanna? That looks like one of those dolls that we use here in the hospital.
Yes, and it will have every site that you can inject into.
That's amazing. Well, this is the abdomen. This is the area that we use for injecting mealtime insulins. So, you see the circle? It's 2 inches away from the navel on either side and below. You can inject in an area that's at least 1 inch away from the last time you injected, going around and around. You do not keep injecting into the same spot, because if you do, you'll get lumps underneath the skin and your insulin will not absorb from there. You can also use the thighs for injection. Because the site of the thighs takes a longer time for the insulin to absorb, I like to use the bedtime or Lantus insulin there. Whereas for the stomach, think of eating. I like to use the Admelog or the Novolog or the Humalog there for meals. All righty. So I've got my pen. I'm going to give it to Deanna, and she is going to remove the top. Now, notice that your insulin is clear. Please don't be afraid. You don't have to fill an insulin pen, and your pen did not discharge all of your insulin and run out over the night. Insulin should be clear. Okay, if it's not clear, don't use it. Now, the first thing Deanna's going to do is clean the top. Now, your insulin pen comes with about 300 units of insulin, so you're going to use the same pen until all the insulin is gone. You will notice that the plunger will be all the way up at the top, and the dial for dosing will not be able to turn. All right? That's when it's empty. So let's get a pen needle out. You'll put on a new pen needle every single time. Deanna is going to remove the paper. And working in a 90-degree angle because you don't want to bend that little needle that's inside there. You're going to screw it right on top, just like Deanna is doing. She's going to screw it on nice and tight. Good. Now she'll remove the first cap, and she won't throw it away because we're going to need that for later. And she'll remove the second cap. And you will see the teeniest, weeniest little needle on the market. You don't even feel that. So you don't have to be afraid of it. Now we want to do something next before we dial our dose. You might see that little bubble in there. little bubble in there. We want to make sure that we don't have any air in our dose, and we want to make sure that our needle is working properly. So Deanna is going to dial to 2. And then she pushing the dosing button at the bottom. She's going to waste that 2 units into the air, and that will tell us 2 things. 1, the needle is on properly, and 2, there is not going to be any air in our dose. Now, what is so important is that if you don't see a drop or a stream of insulin the first time, you can take that needle off and put on a new one and try again. All right? But it should be working appropriately. And when you inject that air shot or that 2 units, we call it priming, into the air, you should be back on 0. All right. So we saw that insulin. Our pin is working. Our needle is working properly. That little air bubble, I don't see it. Or do I? Come here, little air bubble. Do it again for us. Dial to 2. And waste that 2 units into the air. Ah, there we go. All right. So, now what we're going to do is we're going to dial the dose that the provider has us use. Now, I'm going to be your patient. Listen, everybody. I'm not allowed to inject myself with this because this is a teaching pen. But I will show you how you prepare. You will take your alcohol. And let's pretend I'm going to have my mealtime insulin. I'm going to clean an area 2 inches away from my navel. And I'm going to pretend that my stomach is a nice red ball. But you will be injecting right into your skin. All right? So now that that's drying, we can dial the dose that our provider wants us to dial. You will find out what that dose is before you leave the hospital when your nurse does your discharge teaching. But in my case, we're going to dial a dose of 9. We're playing around here. Let's dial a dose of 9. But you, of course, will dial the dose that your doctor orders. All right. So now I'm ready. This is now dry. And Deanna is going to guide my hand. Let's pretend that red ball is my tummy. Okay. And I'm going to go nicely and gently straight in. Now, everybody at home, don't do this with your skin. You don't want to stab yourself. You want to go in nice and gently. And you want to turn your dial around so that you can see when your insulin pen has finished administering all the insulin, it goes back to 0. So guide my hand, Deanna. And I'm going to press my dosing button. And it's back on 0. Now that I've injected this insulin into myself, what should I do, Deanna? Should I take it right out?
After you've counted to 10, then you can take it straight out.
So I should start counting to 10 now?
Yes.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Then I can take it out. Mm-hmm. Now remember I said don't get rid of that white top? There's a reason for that. That is non-penetrable plastic, and we're going to use it to cap the needle again. And Deanna is going to unscrew it, righty-tighty, lefty-loosey. And she's going to keep unscrewing until the pin needle comes off with the cap. And she did it. All right. We will now place this into a sharps container. So since we're in a patient room at Lennox, we will use this sharps container, nice red sharps container. We can get a small sharps container at the pharmacy. Or what else can we use, Deanna?
We can use like an old milk bottle, an old bleach bottle.
something with very thick, non-penetrable plastic, because we are going to use that old Downy, old Clorox, old detergent bottle to put our sharps in. When the bottle is 3/4 of the way filled with sharps, we can put a top on it, the top on it. We can write sharps on it, put duct tape around it, and then we can leave it with sanitation. We don't want our sanitation man to get stuck, so that's why we're going to use something non-penetrable. So in other words, we wouldn't use a bottle like Purell, or we wouldn't use an old Poland Spring bottle, because that plastic is not strong enough and the needle can come right through and stick yourself, stick a family member, or stick the sanitation worker, and we don't want that to happen. We can take our pen, put the top on, and put it away until next time. Once you start using your insulin pen, you can keep it at room temperature for up to 28 days. All right? Keep the ones you haven't used yet in the refrigerator. Now, if you have any questions, you can always call us right here at Lennox. My number is 646-795-9647, and I'll be more than happy to answer any questions for you. So thank you, Deanna. You're a great champion. She does amazing work here on 4 Years, educating our patients, and we look forward to hearing how this worked really good, and we look forward to hearing from your outpatient provider how well your diabetes is being controlled. Bye now.
Bye. Thank you.